profundus is the only muscle in the flexor group that normally doesn't go to the medial epicondyle of the humerus. It's a little below, so it's not in that elbow, it's just below, which is the interosseous membrane of the ulna. So it's most likely not on the, just down here. There's the origin of this muscle. And this muscle goes down. And the difference when it goes down, this muscle, is because this muscle goes all the way down to the distal interphalangeal joint, which is just past. So that goes to this area, to the most distal part here, which is this part here. This muscle, when you contract this muscle, assists to the elbow, wrist flexion, but also at the same time helps also on the flexion of the distal interphalangeal joint. It's this most likely considered like the middle layer muscle in flexor group. Synergies and antagonists to this muscle, they can be the flexor digitorum superficialis for the synergies. Antagonists can be the extensor digitorum. And we're moving on to another muscle, which is the palmar longus. This muscle, normally like the rest of the flexor group, is in the medial epicondyle of the humerus. And when it goes down, they pass the wrist area here, they go to the palmar aponeurosis, which is most likely on the base of the fourth metacarpals here. So this muscle most likely helps only to the assist of the wrist flexion. Doesn't do anything with the fingers because what? Doesn't pass the fingers at all. So the best synergies for this muscle can be the flexor carpo radialis brevis, which just does only the flexion. Flexor carpo radialis brevis. And the antagonist can be the extensor carpo radialis or extensor carpo ulnaris. And here we finish the last muscle on the flexor group. The only left right now is the pronator teres and pronator quadratus. Pronator teres, again, origin goes to the medial epicondyle of the humerus and run down here to the middle shaft of the radius. So that's the muscle fiber direction of the pronator teres. So it's a deep muscle. It's the deepest on the forearm. So that's the way of stripping this muscle. Cross fiber. When you contract this muscle, the arm goes on the pronation. So the synergies of the pronator teres is pronator quadratus. An antagonist of the pronator teres is the supinator. When supinator contract, pronator teres stretch. When the pronator teres contract, the supinator stretch. The last one is pronator quadratus, which is origin. It's 1/4 of the ulna to the 1/4 of the radius. This is the muscle fiber direction of the pronator quadratus, and this is a cross fiber. Pronator quadratus, when they contract, does help pronation, and when they stretch, need to be supinator. So synergies to the pronator quadratus is pronator teres, and antagonist to the pronator quadratus is the supinator. And here we finish all the muscles on the forearm for the week 2 myology.